Hey all, it's Alex again. Today is August 4th, 2015, and I am in Mississauga, Ontario, with my husband Logan.
Hello.
We drove down here today because it's my consultation day with Dr. Hugh McLean for top surgery. So I went, and now I'm going to tell Logan about it, and he's going to ask questions, and hopefully it'll answer some questions that some viewers might have too. So
I'll start off with a question, actually. So we drove down, traffic was terrible, and when we got there, obviously, the price for parking was a lot better than I thought. At least when we were there today, it was. So I stayed in the car just in case. Parking was going to be ridiculous. So you went in. How was it going into the building?
It was really confusing, actually. Like, it's a much bigger building than it looks on the outside. So the McLean Clinic is on the 3rd floor of this building. It has like a bunch of different wings, and I had to go up an escalator and just find the right place to be. So it took me at least, I don't know, 5 minutes to find where I needed to be. And but yeah, the office is really nice in there, and it's like a really nice kind of calming atmosphere. It reminds me of a lot of spas and, like, I guess other cosmetic clinics that I've, like, cosmetic surgery and stuff, clinics I've been to in the past. Sorry, it's really windy on the highway here. So yeah, it was, like, everyone was really nice. The reception staff and everything. What's that one too?
I didn't realize, sorry.
So, yeah. Other question?
Right, so it was confusing but nice. How was it going into the office? Like, were you greeted by the secretary as soon as you went in, or how was it?
Yeah, so, like, there was a desk, a front desk, and the secretary greeted me. I had called in a little bit earlier because I was running late. So once I said, "Oh, hi, it's Alex," she was like, "Oh, yes, Alex, so fill out this paperwork." It was like a 3-page questionnaire, like you get when you go to a new, I guess a new doctor's office or anything like that, asking about your family, your medical history, anything that they need to know, your mailing information, your contact information, just all that, and why you're there, so that they can kind of tailor your experience. So I filled that out, I returned it, and, like, I don't know, less than 2 minutes later, I was brought into a room by the nurse, who's going to be one of the nurses that's overseeing the surgery with Dr. McLean. So she took me into the room, and she basically told me what was going to be happening at the consultation, which was that I was going to talk to her a little bit about my history and any initial questions. She was going to make sure that I was in good health and qualified for the surgery, basically. And then after her, I had my consultation with Dr. McLean, and then after that, I spoke with a lady about financing and scheduling. So, yeah, so that's how that went.
So financing and scheduling.
Yes.
That stood out to me there. What was included in that?
So, in a separate room, it was like, I guess this lady's office, because that's what she does. She does all the finances and the scheduling of appointments. She sat me down and she printed off all of the information that I needed to know and gave it to me in this little envelope.
I was wondering what that envelope was.
Yeah, and basically said, well, here, so it's going to cost $7,500 plus tax for the surgery. So some 8,000 something altogether. But that includes everything that you need for the surgery from the beginning to the end. So all of the appointments, the pre-op appointment, the follow-up appointments, all of the dressings for after the surgery, your after-surgery binder that you have to wear for about a month.
Well, they include the binder.
Yeah,
Oh, that's
all
nice.
included. And yeah, so in order to book the surgery, I had to put a down payment of 10%, so 800 and something. But I didn't have that right now, which was fine because she's just scheduling a few weeks in advance right now. So she was able to pencil me in for January 4th. And she said, when you're ready to finalize everything, although it sounds like everything's good to go, just give me a call and we will, book you in properly. So all I have to do is send in that 800 and something, and then we're good to go. She also explained that I'd have to be there. Someone would have to take me home because it's a 6-hour surgery. It's not. Sorry?
6-hour surgery.
It's a 6-hour surgery.
Yeah.
It's not inpatient. So after the surgery is done, someone has to pick me up. I said that wouldn't be a problem. And then after that, I have to come back the next day. So I asked if there were any hotels nearby, and there is. It's called Novotel.
And we stayed there once.
We did stay there once. And the cool thing about it is if you tell them when you're booking your room that you're going there through the McLean clinic, that you're a patient there, they'll give you a corporate rate.
Oh, that is really cool.
Yeah. So, yeah. What else?
Airplane.
Cool.
Rachel, look. Airplane.
Other than that, what did she say? So there's going to be 2 weeks prior to the surgery, there's going to be a pre-surgery appointment. It's about 45 minutes. Have to sign all of the consent forms and make sure all the pre-care is done and make any final arrangements.
Pre-care?
Yeah, so I'm gonna have to be on some antibiotics. They're gonna prescribe so that and stuff like that.
But you need to get on beforehand to make sure that your body is clean and that your tolerances are built up so that you continue taking it after the surgery to keep your immune system on and just be able to handle the healing process.
Yeah, exactly. What else? Dr. McLean. Okay, so before the consultation, I was really, really nervous about going in because I knew that I was going to have to take off my shirt and my binders, and Dr. McLean was going to have to actually look at my chest, and it was something I was really, really anxious about. And when it came down to it, he was really quick. It lasted a minute, maybe two, and he was really professional, and he didn't make it feel weird or awkward, and he and his staff are all very good about trans stuff too. I didn't feel although all of them knew that I was trans, they didn't treat me any differently than I feel they would have treated a male patient. And yeah, so it was very comfortable, even though not wearing a shirt for me is very uncomfortable. He made it as easy as possible. So that was good. He also showed me a diagram after looking at my chest. So he let me... So you go in, you talk to him for a minute, you tell him a little bit about your backstory after the initial nurse leaves. And then... so he writes all that down. And then he leaves so that you can take off your shirt. He gives you like a little sheet thing that you can cover yourself with. And then you don't have to like lie down on a gurney or anything. You just stand up. He like manipulates your chest however he needs to see what needs to be done. And then he leaves, you put your shirt back on, and he comes and sits down with you again. And then he kind of did a diagram of my chest and what would need to be done. My like breasts, they go pretty far back. So he's gonna have to make the incisions longer so that he kind of minimize the risks of dog ears, whatever that means.
Folding.
Yeah. So because I have a pretty large chest, I'm definitely gonna have to get the double incision option, which is fine. That means I'm gonna have the 2 scars and probably I'm gonna have the nipple grafts as well. And yeah, he doesn't use drains, which is one of the reasons that I chose him as my surgeon, because I really didn't want to have to walk around with the drains for like a month afterward, and I didn't want to have to empty it, and having them removed, I've heard is really awful. So, yeah. Any other questions?
So, total process from walking in and being seen to walking out, how long did that take you? Roughly.
Well, I got there at 10:02. Well, I didn't get in until probably noon. And I was out by 12:40-ish, so about 40 minutes.
Okay, so less than your average doctor's appointment, at least in your case.
Yeah. So I was lucky that way. I don't know, maybe. They seem to be very attentive, so. Yeah, and it didn't seem like too busy a day. Although, the receptionist said it was a really busy day, so maybe everyone was just in having their treatments, or...
You went in at lunchtime, too.
Oh, I did, that's right, I went in at lunchtime. So that's probably a big difference. That makes sense. Oh yeah, so he made special time to see me at lunch, because I was running late. We got stuck on the highway, and we're out of town.
An hour and 45 minutes in, and we hit about 2 large chunks of standstill bumper to bumper on the 401.
Yeah, so we were about a half hour later than we had intended being, and it took us over 2 hours to drive to the clinic from our place in Peterborough. So, yeah.
So all things considered, I'd say it was a pretty positive experience.
Yeah.
Based on how you describe it.
Yeah, so I told the secretary, or not the secretary, the financial lady, I told her that I would pay the 10% down payment on September 1st. And then she said that you have to pay the balance at least 2 weeks before the surgery. So by your pre-surgery appointment. And I also asked if you could do installments until then, and she said yes. So it'll just take the balance down. And I think that's probably better, just so that the money doesn't go elsewhere. We just pay it every month.
Yeah. Well, that sounds good.
So, other stuff that you need before your pre-surgery appointment is you need basically medical history that is provided and signed by your general practitioner or another doctor that you trust, and you also need blood work done.
Did you get a criteria,
Yes.
a prescription for the blood work that you need?
Yes.
So they know exactly what to look for when you take it to the lab.
Yep. Yeah, so it was a good experience. I'm really excited to get my surgery. What is that? How many months is that?
When's your surgery date?
January 4th.
So let's see, we're August now. September, October, November, December, January. 5 months.
5 months. Okay. So 5 months away. That's pretty exciting.
That's really exciting.
And
It'll be here before you know it.
yeah. And I will keep everybody updated. And yeah, that's it. All right. Have a good one. Bye.